In an effort to curb the escalation of chronic infections, health workers and experts in Kabale District are allowing residents to prioritize understanding their status regularly. In Kabale District, health workers and experts are uniting, emphasizing the critical need for individuals to be aware of their health status. This initiative seeks to empower the community to take measures against the potential chronic infections. The call to prioritize health awareness comes as part of the broader strategy to strengthen the health infrastructure. This message was conveyed on Friday at Kigezi High School Primary Lower Playground as Kabale District commemorated the belated World Diabetes Day in a one-day medical camp climaxing the commemoration week that included diabetes, hypertension, and kidney disease screening.
It is very important, like we all are aware, our healthcare system we do not have enough capacity to manage patients with, for instance, stage 5 or kind of end-stage renal failure. So prevention is much more better than cure because we only currently have very few dialysis centers. Like the whole of Kigezi we do not have one. So we believe people knowing their status early is better than managing the last stages of the disease because it's very costly to do dialysis. So we believe doing screening is much more better, and then identifying someone at an early stage of the disease makes management much more better and prognosis becomes better.
According to Kate Chandra, the program's director at Bridge of Life, recognizing the challenges posed by chronic infections, health workers aim to instill a sense of responsibility among the residents regarding their well-being. Through educational camps and community outreach programs, the initiative aims to dispel myths and misconceptions surrounding various health issues, fostering a more informed and health-conscious population.
We wanted to come out and screen and educate, provide greater awareness about chronic diseases. And we have been so excited to see the participation from the community members. We thought there would be a small turnout on day one. Hundreds of people came. We were overwhelmed by the participation from the community. I'm really excited here today in Kabale, despite the rain and the weather. People are still here doing exercise classes, getting screened for chronic kidney disease, diabetes, hypertension, learning their status so they can make behaviors that manage any risk factors, and then celebrating with soccer teams. It's just been a joy to be here in the community.
Dr. Unini Odama, a kidney specialist at Bridge of Life, says that residents should take charge of their health by staying informed and seeking medical attention at the earliest signs of illness. She adds that this approach is key to reducing the burden of chronic infections in the community.
Well, kidney disease, like I said, globally, it's a global problem. It's not just here in Kabale, it's not just in Uganda, it's all over the world. And the commonest causes of kidney disease are diabetes and hypertension. These are things that we can actually prevent. Sometimes it's genetically induced, but a lot of the management we can do by lifestyle. So there's a high consumption of salt in the community. If we can focus on decreasing the amount of salt in our food while cooking, that would be great. If we can focus on eating more vegetables, less carbohydrates, that would also help with the diabetes. If we can have a community exercise program so that people are generally healthy, that would also help with hypertension and diabetes. So the key, like you just said, is really to prevent hypertension and diabetes so that kidney disease does not become prevalent in the community.
Dr. Gilbert Mateka, the Kabale District Health Officer, says that people should revisit their diet and take on doing regular exercises because there is a surge of non-communicable diseases in the community currently. He adds that regular health checkups and screening are vital for maintaining well-being.
Today we are commemorating the World Diabetes Day in Kabale District, and this is to create sensitization among the public because we continue to see a rise in non-communicable diseases in our communities. And largely this is because people are adopting an unhealthy lifestyle, namely people choosing sedentary, lack of physical activity, and that is increasing their risk of being obese, and that comes with a high risk of getting this non-communicable disease. And of course, with the changes in the feeding habits of our people, that is another factor that is causing an increase in the prevalence of non-communicable disease in our communities.
Honorable Dr. Nicholas Kamara, the Kabale Municipality Member of Parliament, says that World Diabetes Day should not only be used as a day for diabetes, but also for the advocacy of prevention, care, treatment, and resource increment. Dr. Kamara adds that residents should shun the risk factors of non-communicable diseases, including the sedentary lifestyle, excessive alcohol consumption, and poor nutrition.
We are commemorating World Diabetes Day in Kabale World Diabetes Day is supposed to be commemorated on 14th of November every year. This is the birthday of a man called Frederick Banting who discovered insulin. So to remember him, we celebrate World Diabetes Day on this day. World Diabetes Day is not supposed to come to solve all problems of diabetes. World Diabetes Day is a day of advocacy. Advocacy for prevention, advocacy for care, advocacy for treatment, and advocacy to increase resources in diabetes care and prevention.
Andrew Nangori, the program coordinator at Global Livingstone Institute, says that they have conducted a one-week diabetes, hypertension and kidney disease screening program in different areas in Kabale District. Nangoli says that this has been to create awareness among the locals about non-communicable diseases.
We have a big program, we call it Impact Program, where we have such screenings happening on a site like this, but we have an ongoing follow-up program where those who turn at high risk are followed up for a period of 12 months, and we have a team of trained community health workers that we support in the program to do these massive follow-ups.
Amanyamagara gawe kuko ugemerire kirakuyamba kugira ngo utunge ubuhereza imibazi juba utakayikire hari ahubwo kube ndwara kwera heza kutemba yaza higuru yakurenga utajimanyire ekwita ju kunka waza yo kare uremanya then utunge ubuhereza juba.
As the community embraced the value of knowing and managing their health status, the prospect of reducing the burden of chronic infections becomes a tangible reality. The World Diabetes Day is commemorated annually on the 14th of November. Nobati Nyamachi for Kigezi Television.